We'll see you, check.
Well, good morning, everyone. Thank you for joining us today. This past week, our region has felt the impacts of the increase In COVID-19 cases, as of Friday, the Alabama Department of Public Health had listed numerous counties in North Alabama as high risk or very high risk on its COVID-19 risk indicator dashboard. We must take care to prevent this trend from continuing, and we're going to talk about that as we go on today. I'm honored to have with us our guest, Morgan County Commission Chairman Ray Long. Chairman, thank you for joining us today.
Glad to be here.
Yes. And then Judy Smith, everybody knows Judy with the Alabama Department of Public Health. Judy is the administrator for the Northern District. So currently, Morgan County, we have 3,806 positive COVID-19 cases, which brings us to a 6.97% weekly case increase. From Friday to this morning, we've added 139 cases. Morgan County is still listed as a very high-risk county on the risk indicator dashboard. We must remain vigilant. I encourage you to remember to keep wearing your mask, sanitizing, and practicing social distancing. Now we'll talk a moment about Halloween safety. Like we said last week, as you begin to think about the upcoming holiday season, please remember that we still need to wear our protective mask, not just our costume mask, and socially distance. Tips regarding this can be found on our website at DecaturAlabamaUSA.com and our social media platforms. We'll talk about a flu clinic. I'm sure Judy will have more on this topic, but take note that the Morgan County Health Department and our Emergency Management Agency will host the annual flu clinic tomorrow, 9 a.m. to 2 p.m. at Central Baptist Church on Highway 31 in Decatur. The cost is $5 per shot or free with Medicare. As we do each week, we want to remind you to be a good neighbor. Call someone in your neighborhood, check on them, especially the elderly. And so with that, Chairman Long, update from the county.
Everything's good, Mayor. We just rolling right along. We still, as the Mayor said, we want to encourage everybody to keep wearing your mask and keep your hands clean. And we're doing things that we can at the courthouse to try to keep people from coming in. Remember, everybody got their property tax notices. Remember, you don't have to come to the courthouse to do that. You can do it online. Use your credit card, debit card. There's no charge. The county's picking that up. That keeps you from coming in and mixing with folks. The more social distancing you can do. And I know Judy will explain more about that, but the more you can do, the better. And so we're wanting to do our part to keep people out of the courthouse if we can and do their business online. As I walked out the back door a few minutes ago, we probably had 15 folks there waiting to buy tags. And, we say this every week and we push it, but, most of that stuff, 90% of the stuff you need from the tag office can be done online at no extra cost. And, when you go online, order your tags, 2 or 3 days, you're going to get it. It's just, we doing all we can do. We just can't make people get it through their mind. Some people I know don't have internet and stuff, and they have to come. But if you don't have to come to the courthouse, we encourage you not to. People own it. It's free to anybody to come. But if you can do your services without coming, it just helps us all. I mean, we've got to get out of the red. We got to get back. We had several good weeks where we was doing what we needed to do, and I think people got laxed on that, Miss Judy. But these things, whether you believe in them or not, wear them. You may save a life. Thank you.
Thank you, Chairman. Miss Judy?
Thank you both. I want to answer first the most important question of the day, and that is no, if you have 1 positive test and 3 negative tests, it will not make you win your ball game, so don't even try. Red is a great color for the Crimson Tide. As the chairman said, it's not such a great color when we're talking about our COVID status in Morgan County and Decatur. I will say, again, it's been a tough month, just to be perfectly honest, and I think getting out, the beautiful weather, the fall weather, and people getting out and about, it's kind of like they said, a lot of folks have just kind of given up on this and just kind of gotten really discouraged. 42 of Alabama's counties have had an increase in the past week. Across the state, there has been 133 additional deaths in the past week. Fortunately, none of those deaths were in Decatur, Morgan County, and we would like to keep it that way. We have made a lot of really tough decisions in the past few months, and quite honestly, we've got some really tough decisions coming up. You know, the leadership of our nation is coming up. 2 weeks from tomorrow, you know, we all have an opportunity to vote, and if I'm not mistaken, today is the last day that you can register to vote, and so that's imperative because it's going to make decisions about where our country goes, where our state goes, you know, just our future as a whole. The census, fortunately, it was extended a while. You can still do the census. It is imperative that we continue to get the federal money that this county and this city need. So please, if you have not done your census, you know, and then down the road we talk about not having enough money and federal money not coming in here, we make that decision. And the third thing that's really critical today is that we will be making decisions about the health care of our state, our county, our city, and we're already making them. And unfortunately, I'm afraid we're backpedaling some when we talk about the numbers that we just talked about. You know, it's really scary. Our numbers are up, our hospitalizations are up. There's a whole lot of sick folks. As you all know from watching the national news, in the United States, we have over 8 million people that have had COVID virus. We have 220,000 that have died because of this. But to bring it closer to home, in Alabama, we're currently looking at roughly 174,000 people in Alabama that have had COVID virus. I already told you we had an increase of 133 deaths. When we look at those numbers, we always, we want to be encouraging, but, you know, it says that 74,238 people have recovered, and that's great. That's like 48% of the total folks that are listed as cases. The bad side to that is there's 52% of those folks, a bunch of folks, you know, almost 80,000 folks that are still out there somewhere in limbo between having just gotten the virus, maybe being in the hospital, you know, whatever. Morgan County itself currently has 3,945 cases, and that includes the probable cases. 12.4% of those, now keep in mind, we've been doing this for 7 months, 12.4% of those have been in the last 14 days. We can't continue to let that go in that direction. And I want to give you also your hospital report today because I think it's one of the most important things that we talk about. Currently, there are 37 people in Decatur Morgan Hospital that are either confirmed or they're persons under investigations waiting for their test. There are 8 people in the ICU, and 4 of those, half of those, are on vents. We're at flu season, and don't let me forget to talk about the flu clinic, but we're at flu season. We simply cannot have our hospital so inundated that it can't take care of the folks, all of the folks that it needs to take care of. So please do your part. You know, I know you're sick of hearing us say it. Quite honestly, we sort of thought we were going to get to tone down, and then things have again circled back and are kind of going in the wrong direction. So I guess we'll keep coming back, and we'll keep saying it for a while. So please do your part. You know, everybody is sick of the mask. Everybody's sick of it. We're tired of it. We're tired of the ongoing thing. But I want to tell you a little secret about 2 or 3 other things. The leading causes of death in this state, now it may not stay that way, the way things are going, but the leading causes of death in this state, quite honestly, are heart disease and hypertension. Both of those conditions require medicine in order to manage them. People that have it are sick of it. They're sick of having to take pills. They wish there was a vaccine for it. There's not. They're waiting on it, and I hope it happens one day. People who have diabetes stick their fingers several times a day or do some type of testing. They're sick of it. They're tired of it. It gets old. They don't get to eat pancakes anymore, and it's very tremendously inconvenient. But it is what it is, and they do what they have to do in order to manage it. I would be remiss if I did not point out to you that this is Breast Cancer Month, and I also brought my breast cancer map. It's a map too, but it's a map. I actually am a breast cancer survivor. This is very, very important to me. You know, and I will tell you up front, it's not something you want to have, it's not something you want to do, but there's not a vaccine for it, but you do what you have to do to get to where you need to be. Every one of these things is a journey in itself. COVID is a journey. The mask is not fun. We hope we'll have a vaccine. It probably is going to be next year before it's available to the general public, but we do what we have to do to protect our own lives and protect the lives of other folks around us. To end, we do have a flu vaccine clinic. It is tomorrow. It is at Central Baptist Church, as the mayor has already said. Yes, we do ask for $5, and we do ask for Medicare. You know, Medicare will cover it if you have that. Some insurances will cover it too, but let me also say, no one will be denied a vaccine based on their ability to pay. We're here to protect people, to take care of you. You do not need to have the flu and have COVID. So please, together, let's take care of the people in this city and let's take care of the people in this state. And please forgive us if we keep saying it. Stay away from other folks and please wear your mask. Thank you, sir.
Thank you. A couple of questions on the flu clinic. Will people need to pay with cash?
Yeah, oh, yeah. We're not that high class.
No credit card?
No,
Yeah.
the chairman would not bring his debit card down, his little swipe machine down there,
Right.
so. But you will stay in your car, by the way. You will not get out.
Okay, so will the location be in the front, so you come through the fountain?
It's actually in the back, and the
Okay.
EMA has it designated. There will be somebody there that shows you how to turn, and I'm sure the chief will be down there to give tickets to anybody that turns at the wrong place. But you will come in, you will go to the back, and then you will go out a different street. And I did have the street number. Do you know, Chief, what it is?
That's
But at any
Cedar-
rate, you'll
Cedar-
come on the north
Cedar
side, you'll
Lake.
go up and you'll go to the back of it. You'll register, you know, it's a couple of forms you have to fill out to give us consent to get your flu vaccine, and then, you know, you'll go to the next station, the nurses will give it, and if you come, I promise you I will give yours personally. How about that?
Thank you so much.
You're so welcome.
I've had mine.
I had mine too. We both took the high risk one, didn't we? 'Cause we- So-
So the entrance will be on Cedar Lake Road, as I recall. Yeah.
Okay, yeah,
there we
Cedar
go.
Lake Road.
Well,
Plaza Street. You go in on Plaza Street and then you come out on Cedar Lake Road. Isn't that correct? So you'll turn on Plaza Street. But there'll be somebody down there to give directions. The police are going to be there to help us with traffic control. And but you'll come in one entrance and you go out the other so that hopefully we don't have a bog while you're
good.
down there. Thank
Thank
you.
you.
We do have a little gift we'll be giving to folks that do come through the clinic. It doesn't cost you anything to try to help remind you to also take care of the COVID. So please come if you can.
Just a reminder on the time for the flu clinic, that's 9 a.m. to 2 p.m. Tomorrow. All right, any questions? Okay, very good. Well, we will return Monday, October the 26th at 10 a.m., and I hope you have a good day. Thank you.
And thank you both.
Sure.
Can I
thank
give you yours?